Time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, there's a new experimental treatment for paralysis that involves doctors zapping patients' spinal cord with electricity. John?
Anthony, the new technique is not a cure, but researchers who developed it say it could be a game changer for people who are paralyzed.
In 2010, Dustin Shilcox was in a car accident that left him paralyzed from the chest down.
I never had any progress back as far as movement or any signs to know that I would have any movement or walk again. Just stimulator box.
But since implantation of a spinal cord stimulator over a year ago, he can move his legs and wiggle his toes.
I'll bring my leg back and I'll try.
That is amazing. You're thinking move.
Yeah, so so like when I'm not doing anything, it just sits there, and then like I said, when up, I just tell it to move, and I start having control of my legs again. It's pretty exciting.
Spinal injuries disrupt nerve pathways that come from the brain and initiate movement. In this study, researchers implanted an electrical stimulator at the base of the spine. When it's turned on, impulses are emitted that appear to awaken injured or dormant nerve pathways. Shilcox still can't walk and has no feeling from the chest down. But researchers were surprised he could move his legs by thinking. Dr. Claudia Angeli led the team.
What we're doing is waking up the spinal cord and allowing it to be ready to receive a signal from the brain.
Shilcox is one of 4 patients who are now able to voluntarily move their legs with the help of the device. The technology was first tried 3 years ago when researchers working with the Christopher and Dana Reeve Foundation announced that Rob Summers, a paralyzed former baseball player, was able to move his legs.
What's it like to you?
It's a miracle for me. I mean, when I can move my legs when I'm not supposed to.
John, this is so exciting. You mentioned there are 4 patients in all. What's happened with the others?
They're doing great. All 4 can stand up, all 4 can think and move their muscles. And I just spoke to Rob Summers, who is patient number 1. And when I first interviewed him 3 years ago, he could move his legs, but just sort of by getting them started by moving his upper body, not by thinking. A few months later, he's in the lab, and suddenly he can move his toe. And it was unbelievable to everybody. They just could not believe it, because never in a million years did they think that you could somehow reestablish the connection that had thought to be totally severed between the brain and the muscles.
It's such a good piece that you did, but I'm curious, what's the next step?
The next step is to do more patients. It costs $400,000 per person in terms of the research costs. So they're going to do another 4, and they want to expand it out to other places throughout the country. But, you know, Rob said this coming summer, he is going to be asked to throw out the first pitch at Dodger Stadium. He says he's going to do it from the wheelchair, but next summer, he's going to do it standing up from the pitcher's mound.
We hope so. Well, also this week, a new report challenged the assumption that antiviral medications like Tamiflu offer significant help against the flu. The Cochrane collaboration reviewed the records of 24,000 patients who used Tamiflu. It concluded the drug decreased symptoms only slightly and did not reduce cases of pneumonia or the risk of death from the flu. Holly, this is the drug. This is the one we always hear about government stockpiling. So what does this mean?
Sure. I mean, and the U.S. itself, we've really invested a lot into stockpiling the drug, about $1.3 billion, in case of a big flu pandemic, which we know could threaten a lot of lives. But really what they found was that the drug does decrease the length of symptoms from 7 days to 6.3 days, but they found that it does not decrease the risk of death or complications like pneumonia from the flu. So it's really calling into question how well prepared we are in case of a pandemic if these drugs aren't effective in that setting.
And this drug's been around for a long time, Holly. Why is it taking so long to figure out whether it actually works?
Well, right. The FDA approved it in 1999, and some other drugs followed shortly after that function in the same way. But really the understanding is that these drugs are safe for most people and that they decrease the length of flu, not necessarily that they stop pneumonia or death. Now, the CDC is standing by the recommendations for the drugs, saying they're still good for treating the flu and they're not going to change their minds yet. But not everybody agrees with the new research.
John, speaking of that, I imagine a lot of the drug manufacturers aren't very happy with all of this.
Right. Roche strongly disagrees. They say that a study that they funded showed a 19% reduction in death. But I think that there's really a sea change here, because you asked why it took so long. Well, the people who did the Cochrane collaboration said to me, you know what, the reason is that we've never had the actual raw data to analyze. It's always been the authors of the papers. Now it's publicly available, and now is the chance for other people, not the people who actually wrote the paper or perhaps were being funded by the drug company, to analyze it, come up with their own conclusions.
April is National Distracted Driving Awareness Month, and this week the Department of Transportation launched a series of graphic ads warning against texting behind the wheel. The first ever national campaign will run on TV, radio, and digital media. The DOT estimates more than 400,000 people were injured and 3,000 were killed in distracted driving crashes in 2012.
Another new study out this week from Massachusetts General Hospital has some fascinating findings on the importance of a good relationship with your doctor. Well, me and Anthony have good relationships with two doctors we know very well. But John, tell us about this study.
Well, it makes perfect sense. You have a better relationship with your doctor. You want good communication. You want the doctor to be sensitive and empathic. But a question has been, does it actually make a difference in terms of outcomes, in terms of things that you can measure? And this is a review of the literature. They looked at 13 studies, and they were able to look at things that could be measured, like high blood pressure or weight loss. And sure enough, there was a small but statistically significant increase in the positive outcomes from these interventions that made communication better, empathy better. So that was kind of a good thing to have proof of.
Holly, does one then maximize their relationship with the doctor to get these kind of benefits?
Right. Well, I mean, there are things we all often think about. Be honest with your doctor, communicate openly. But something that's very important, like most relationships, the more time you spend with that person, the closer you become. So to the best of that you can, if you can see the same doctor over and over the period of years, that really fosters the best relationship you can get. Now, I know it's not easy. Especially in primary care, most doctors work in groups. So each time you go in, you might see a different one. But if you're scheduling, let's say, your yearly physical or something that you can do well in advance, try to see the same doctor every time, and that'll really improve the relationship.
Finally this week, lots of grandmothers will tell you that spending time with their grandchildren is one of life's great pleasures. But it turns out that taking care of grandkids may also help postmenopausal women reduce their risk of Alzheimer's and other forms of cognitive decline. That's actually really interesting.
What I loved about this study was that, yes, it was true for a little bit of interaction, that makes sense, but the grandparents were caregivers for 5 days or more, actually their cognitive function declines.
Right, so it's like kids are good for you, but only in moderation, right?
I'm not going to mention that part of the study when I call my mom.
Exactly.
Dr. LaPook, Dr. Holly Phillips, thank you both.